Here we are going to discuss few questions about the postpartum care and complication of pregnancies. It is the part of maternity. So the question here showing a rubella titer result of a one-day postpartum client is less than 1.8 and rubella virus vaccine is prescribed to administered before discharge. The nurse provide which information to the client about the vaccine, especially rubella vaccine. Hmm? So select all type. So out of the 6 option, which one you choose about the vaccine? So in this question, we can see the rubella titer result of one day postpartum client. So mother delivery a baby, then we are checking the rubella titer and we found the 1:8 and rubella virus vaccine is prescribed to administered before discharge. Question come, right? When you see something like this about the rubella. Hmm? So now let me go and read one by one what are the answer. They said the breastfeeding need to be stopped for 3 months. So if the breastfeeding stop, how baby will survive? Why we choose the alternative of food, right? So let's do the stop the rubella rather than stop to the breastfeeding. So we will not stop the breastfeeding for 3 months. Definitely it is not an answer. Pregnancy needs to be avoided for 1 to 3 months. Definitely. So when you give the rubella vaccine, hmm, tell mother to avoid the get pregnant next 1 to 3 months. So it is one we choose. Also, vaccine is admin by sub-Q route. So in my vaccination class, I explain all vaccine together and I also gave you the class recording. So vaccine, rubella vaccine, we give sublingually like insulin, right? So it is give subcutaneously like insulin. Exposure to immunosuppressed individual need to avoid. In my that lecture, I discuss in what medical condition it is good to avoid the vaccination. So if patient have a high fever and patient vaccination date is today and today is high fever, definitely avoid. Exposure to immunosuppressed, if anybody is immunosuppressed, definitely we have to talk to the physician healthcare provider, right? And it is good to avoid for them and need counseling. So it is also we should choose hypersensitive reaction can occur if the client has allergy to the egg. Yes. Hmm? So if anybody has a allergy to the egg, we never give them a rubella vaccine. Last one said the area of injection needs to be covered with a sterile gauze for 1 week, and definitely no. So why you cover it for 1 week? So it is not a answer. So our best option. So here we are going to learn, right? So this is the 4 option is true about the rubella. So it is our choice. So when you submit it, we can go and read the rationale. What is rationale here? They said rubella vaccine is administered to the women who have not had rubella or women who are not serologically immune. The vaccine may be administered in the immediately postpartum period to prevent the possibility of contracting rubella in the future pregnancies. It is the live attenuated vaccine. So live attenuated rubella virus is not communicable in the breast milk or breastfeeding. So breastfeeding does not need to be stopped. Okay, so the client is also concealed not to become pregnant. So when patient is ready to discharge, we give them rubella vaccine for future pregnancy, but in the same time, we tell them few basic information about the rubella vaccine. What it is? One is the not to get pregnant next 1 to 3 months. Also, rubella vaccine supposed to give subcutaneous route, and if immunosuppressed, it is good to avoid. Or if patient has a history of hypersensitivity reaction to the egg, they are not suitable candidate for rubella vaccine. The second question here was said. So here we go. The nurse is providing instruction to a pregnant client with human immunodeficiency virus or HIV. So a nurse is providing instruction to a pregnant client with a human immunodeficiency virus infection regarding the care to a newborn after delivery. Very challenging. So the client asks the nurse about the feeding option that is available. Which response should the nurse make the client? So I said, if any mother is positive to HIV, we give them antiviral medication, then viral load should be low and we allow the pregnancies. But most challenging during the delivery process, if the viral load is controlled, if the mother is take the antiviral medication, we allow the continue the pregnancies, but during the delivery, the chance to transmit the infection from birth canal to the infant. So during the delivery, we try to avoid like episiotomy. We try to avoid excess secretion, and also tell mother after delivery, it is good not to go for breastfeeding, right? And also baby should check the virus for HIV. It's called ELISA test. So what is option here? So they said, which response should the nurse make to the client? You will need to bottle feed your newborn. I already explained. It is good not to give the breastfeed. Okay, never ever. So definitely it is the option. What's next? You will need to feed your newborn by nasogastric tube feeding. We do not need it. You will be able to breastfeed. So next here, you will be able to breastfeed for 6 months and you will able to breastfeed for 9 months, but we know that mother absolutely do not give the breastfeed, right? If mother is HIV positive. So definitely our choose is one, because we know this is one. So now go rationale. The perinatal transmission of HIV can occur during the antepartum period, antepartum, during the labor, or during the birth process, even postpartum period. So how postpartum period? Best common is a breastfeeding, through the breastfeeding. During the labor, how? Because of episiotomy, the secretion, blood, if you come in contact with the baby, that chance, even antepartum period, right? Like if mother is interested for some investigation like amniocentesis, chorionic villus examination, it the chance of infection spread out. So tell mother not to do this. That's it. Next question here. Next question here. So a they said a stillbirth baby was delivered in birthing suite a few hours ago. After delivery, the family remained together and holding and touching the baby. Which statement by the nurse would assist the family in the period of grief? Hmm? So in this question, the key point is the baby is a stillborn baby. A stillborn is the death baby basically, or loss of a baby before or during delivery, right? So in that scenario, mother or family need mental support, psychological support, very important. So now question, in that scenario, so what statement by the nurse would assist the family in their period of grief? They said, what can I do for you? What can I do for you? Said, and now you have an angel in heaven. And number three, don't worry. There is nothing you could have done to prevent this from happening. So number three is not an answer. It does not make any sense. Baby die and any aren't give a statement like this. We will see to it that you have an early discharge so that you do not have to remain reminded of this experience. So also it is not a logical about the early or late discharge. Now go for one and two. Now you have an angel. So it is also the statement, and make a summary and um, tell something, but you do not need. What can I do for you? It is the question. Patient can verbalize their feelings because family loss a baby or death baby occur. They need some psychological support. So in that scenario, if you ask something so that mother can or family can verbalize their emotion, and like, what can I do for you? You scope them to tell this is therapeutic communication, right? So always keep in mind in that scenario, we always consider about the we always consider about the culture. It should be keep it mind about it. Okay. So I said it is a good option is this. So next here, rationale. So when loss or death occur because still born baby, the nurse should ensure the parents have been honestly told about the situation by their healthcare provider or other on the healthcare team, it is important for the nurse to be with the parents at this time and to use therapeutic communication technique. The nurse must also consider the culture and religious practice and respect to the belief, right? So I said this is the question you can ask. Therapeutic way of communication, tell the patient so that they can verbalize their feelings. So question here, the nurse in a maternity unit is providing emotional support to a client and her significant others who are preparing to be discharged from hospital after the birth of the dead baby fetus. So you see this question also like the stillborn baby like before, which statement made by the client indicate component of the normal grieving process, right? Means the coping mechanism. So my friend, before to go to the answer, I could tell you if anything happened like this, baby born, but dead baby born, lost the pregnancy before or just after delivery. So in that scenario, it is very hard for the mother or family to coping. So we have to help them how to easily coping the situation. And again, I said, you are very important person to communicate with them as a therapeutic way. So when mother is ready to discharge, aren't supposed to be there, they can teach them, right? If they have any question. So now they said out of 4 options, so which one indicate they easily adjust with the loss? Which statement made by the client indicate a component of normal grieving process, coping process, right? Keep in mind, psychological support or tell the mother to talk with the supporting group. It is very important, right? So we want to attend a supporting group, wonderful supporting group. They motivate, they give the psychological support. So one is a good choice. We never want to try to have a baby again. Definitely, it does not make any sense. Why people will be hopeless? So we are going to try adopt a child immediately. It is their matter. You do not say anything yes or no. We are okay and we are going to try to have another baby immediately. So I said number 4 is good choice. Conflict number 1 or number 4. But I said we are okay, we are going to try, but it is very early to say like this. Maybe patient are not normal. So tell like this. But number 1, we want to attend a supporting group means they want to heal up. They want for support, psychological support. This is the normal process of coping or grieving. So now we choose 1. They said 1. What are the rationale? A support group can help the parents to work through and their pain by non-judgmental sharing of the feelings. You see, non-judgmental. The correct option identify a statement that indicate a positive, a normal, grieving process. Although the other option may indicate reaction of the client and significant others, they are not specifically part of the normal grief process. The nurse is evaluate the ability of a hepatitis B positive mother to provide the self-bottle feeding to her newborn during the postpartum uh, postpartum care in hospital, which maternal action based example to the mother's knowledge of potential disease transmission to the newborn. So you see the nurse evaluate ability of the hepatitis B positive mother. Okay, so hepatitis B easily transmitted, right? So hepatitis B, if we do not take care of it, they lead to the cirrhosis, liver cirrhosis, and liver cirrhosis lead to the develop liver carcinoma. So if we have any clear ideas how to hepatitis B transmitted, and if you stop the transmission, right, then it would be okay. It would be fine. So I said to answer this question, first of all, we have to know how hepatitis B transmitted, because it is a contagious disease, easily transmitted one person to other person. It is the contact disease, right? So usually if any blood or any body fluid is come in contact with the other person from infected person, it is easily transmitted. So mother give a fetus and feeding to the fetus, definitely they have to know how to stop the transmission to the baby, right? So what is the correct option? So now question is here, the mother knowledge. So what are the example out of 4? Which one is reflect mother has a good knowledge how to stop the hepatitis B from mother to the baby? They said the mother required that the window be closed before feeding. It does not make sense anything, right? Hepatitis B is a contagious disease. It is easily transmitted, is contact precursor. So window open or closed does not matter. Mother hold in if the airborne, maybe we can think it is not a airborne. Mother hold the newborn properly during the feeding, which no, never. The mother's test the temperature of the formula before initiate the feeding. It is good choice, but not for this question. Every mother must check the temperature of the formula before to feed. But this number 3 not match of this question. The mother washes and also dye the hand before and after self-care of the perineum and asks for a pair of gloves before feeding. Wonderful, right? So hand wash and also wear a gloves. We can prevent, if we follow the universal precursor, we can prevent it. Universal precursor, we can prevent it, right? So hepatitis B virus is highly contagious and transmitted by direct contact with blood and body fluid of infected person. The rationale for identifying the childbearing client with this disease is to provide adequate protection, right? Protection of fetus and newborn, to minimize the transmission to other individual, and to reduce maternal complication. The correct option provide the best evaluation of maternal understanding of the disease transmission, right? So I said, in case of hepatitis B, we could follow the universal precursor. What does it mean, universal precursor? It means hand wash before and after, and wear the gloves. That's it. So now let me check the second question. So the nurse in postpartum unit is caring for a client who has just delivered a newborn, and also following a pregnancy with a placenta previa. So the mother had a complication, the placenta previa, right? There are two types of problem. We can say one is the placenta previa and other is abruptio placenta, right? This is the complication. So if mother have a placenta previa and still they mother delivered a baby, in that scenario, the nurse review the plan of care and prepare monitoring the client for which risks associated with placenta previa. I said there are two complications. One is placenta previa, other is abruptio placenta. Placenta previa, it is when the placenta is located low to the uterus, or placenta is very close to the opening of uterus. In that scenario, the placenta might partially or completely cover with a cervix. Okay, and patient anytime can chance to cause the bleeding. Okay, so bleeding measurement is very challenging in case of placenta previa or abruptio placenta. Patient also complain of pain, but here the question said which is the the nurse review the plan of care and prepare to monitor the client for which risks associated with placenta previa. I say bleeding means hemorrhage. If mother if mother too much blood loss, the chance to develop hypovolemia, and hypovolemia lead to shock, right? So bleeding control, hemorrhage control is most important basically. So what said? Infection, hemorrhage, chronic hypertension, and disseminated intravascular coagulation. So placenta previa, most priority, challenging to control bleeding or hemorrhage. So now what rationale say? In placenta previa, the placenta is implanted in lower uterine segment. The lower uterine segment does not contain the same intertwining or muscular at the fundus of the uterus, right? So bleeding is occur easily. So maintaining hemorrhage is most important for this client. This question said the nurse is assessing a client who in the 6-hour postpartum after delivery a full-term healthy newborn. So 6-hour postpartum, the client complained to the nurse of feeling of fainting or dizziness, right? Feeling of fainting and dizziness. Which nursing action the most appropriate or most priorities? Okay. So complain of the nurse to feeling of faintness and dizziness. So after postpartum, my friend, during the delivery, a good amount of fluid loss or blood loss. When blood loss or fluid loss, they lead to develop hypovolemia. When hypovolemia occur, blood pressure also go drop. So if patient develop blood pressure or hypotension or blood pressure go down, we say hypotension. So if patient have a hypotension, that times it is very easy to complain of dizziness or faintness. So if patient have this type of problem, just came from labor or delivery, what we could do first? Raise the head of the client bed. It is not related to this. If the down head of the bed, we can think, but not raise. Obtain hemoglobin and hematocrit below. It is the routine exam. We could do this, but maybe not priority. Instruct the client to require help when getting out of the bed. So, and inform the nursery room nurse to avoid the bringing the newborn. So nurse to avoid bring the newborn to the client until the client's symptoms have subsided. So definitely number 1 and 2 is not a choice. Answer maybe number 3 or maybe number 4. Out of these two, definitely number 4 we do not allow. But first priority here, we could stop the client. Don't suddenly change their posture, right? If blood pressure drop because of hypovolemia, because this patient is postpartum care, and so patient complain the dizziness, the chance to fall. So prevention fall is important. So number 3 is the choice. What is their rationale? What they said? Orthostatic hypotension may be evidence during the first 8 hours after the birth. So this is the note we learn after delivery, first 8 hours, patient turns to develop orthostatic hypotension. If mother have orthostatic hypotension, tell them don't change the posture suddenly. If you lying down, better to sit on the edge of the bed for a minute, then from sitting to stand up. So feeling of faintness and dizziness are the sign that precursor the nurse to focus the intervention to the client safety. The nurse should advise the client to get help the first few times so she get out of the bed. So this is the best option for the question. So the postpartum nurse is providing instruction to a client after birth of a healthy newborn. Which time frame should the nurse relay to the client regarding the return of vowel sound. I said here we are together to learn something new. It's not true that every information you have to know. So we are practicing and we are going to learn, right? So basically, any kind of, operation or handling with the bodily system, definitely the bowel, it take time to reback, okay, bowel sound. So postpartum nurse providing instruction a client after birth of healthy newborn, which time frame should the nurse relay the client regarding the return of bowel sound. So I said the uterus is very close to the last guard. So when it is handling delivery occur, C-section or episiotomy, so it is, and also mother should be nothing by mouth. It take time to reback the sound, right? Bowel sound. So it is very important, informed or we could know. So what time after auscultation we can hear the sound, right? Bowel sound when return, basically. 3 days, 3 days postpartum, 7 days postpartum, on the day of birth and within 2 weeks. Number two, you see the how different it is. So I said out of them, our priority, answer is 3 days, 7 days, within 2 weeks. How gap every choice? Okay, if you do not know that much, also you have a common sense. It will be not wait 2 weeks, not even 7 days, right? But of course not in the same time, same day. So 3 days postpartum time. So this is the 3 days. So what are the rationale? After birth, the nurse should auscultate the client abdomen in all four quadrant to determine return the bowel sound. Normal bowel sound usually return 2 to 3 days postpartum. So this is the note we learn. So after postpartum, usually it take time to return back the sound. Usually 2 to 3 days postpartum, right? So next question here. So next question, what say? They said here, oh no, here, the nurse is planning care for a postpartum client who had a vaginal delivery 2 hours ago. The client required an episiotomy and has several hemorrhoids. So I said sometime episiotomy is not a surgical operation, but minor cut to facilitate the delivery. And also during the labor time, also some of the mother can develop the hemorrhoid, and this type of hemorrhoid will be disappear after a few days of delivery, right? So I said in case of episiotomy, I said what should do and what are the priority of nursing consideration for this client. What are the consideration here? Client pain level, then inadequate urine output, client perception of body change, and also potential imbalance body fluid. Potential imbalance body fluid, right? So client perception of body change, it does not make any sense here. Potential for imbalanced body fluid volume, it does not relate it even. Inadequate urine output, it is important, but this question directly not related to inadequate urine, but it is important, I said. According to the Maslow's hierarchy, what are the first, what are the number one, what are the physical demand, pain management, right? So I said episiotomy we can make, uh, bigger the birth canal to facilitate the delivery. It is a minor surgical cutting the area. So pain is very natural. And according to the Maslow's law, pain management is the first priorities, right? So definitely we could choose number one. So what is their explanation? Let me read it. If any note we need to write down on a paper, we could do. The priority of nursing consideration for a client who delivered 2 hours ago and who has an episiotomy and hemorrhoid, the client pain level is very important. Most clients have some degree of discomfort the during the immediate postpartum period, and there are no data in the question is indicate about the urine output. This is the reason we do not choose number 2. And number 3 and 4, no, does not make any sense. And I said pain management is the first priority, and patient have a two problem. One is the episiotomy, other is the hemorrhoid. This is the answer.